Warahmatullahi wabarakatuh. My name is Safa Karina Diva and I am from international class. Today, I would like to share you my opinion about the COVID-19 vaccine in a view of axiology perspective. Today, we will discuss about the COVID-19 vaccine, axiology perspective, hoax and COVID-19, and also the role of stakeholder. COVID-19. Coronavirus disease is caused by SARS-CoV-2, which causes mild to severe respiratory illness, including death. They usually circulate in animals, and some can be transmitted between animals and humans. This new coronavirus affecting humans has been named COVID-19. The new strain of COVID-19 was first reported in Wuhan, China in December 2019. COVID-19 has since spread to all continents all over the world except Antarctica. This coronavirus disease is rapidly spread, and this is what makes this virus spread throughout the world from one person to others via droplets that produce from the respiratory system of infected people, often during coughing or sneezing. People with COVID-19 have had a wide range of symptoms that reported, from mild symptoms to severe illness. These symptoms may appear 2 until 14 days after exposure to the virus. Anyone can have mild to severe symptoms that are fever or chills, cough, difficulty of breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, runny nose, nausea or vomiting, and also diarrhea. Older adults and people who have severe underlying medical condition like heart or lung disease or even diabetes seem to be at a higher risk for developing more serious complications from COVID-19 illness. Asymptomatic people. This coronavirus is also contagious before symptoms appear, which is why so many people get infected. Infected patients can also be asymptomatic. They do not display any symptoms despite having the virus in their system, especially during the first stages of the disease. Prevent COVID-19. First, we can wear a mask. Referring to WHO, the most effective types of masks can prevent COVID-19 transmission are medical mask or surgical mask, 3-layer non-medical mask, respiratory mask such as KN95. Then, we can wash our hand frequently by using 6 steps to wash our hand properly according to WHO. Maintain ethical coughing. It's also important by covering our mouth with the sleeve or elbow. Do not touch our eyes, nose, or mouth with unwashed hand. And always keep reminder, always clean and disinfect with alcohol. And the last but not least, do social distancing to avoid contact with sick people. So, the spread of COVID-19 is very easy and frightens all over the world. But if the preventive action is taken that is supported by everyone and always think positively, we can certainly reduce the number of COVID-19 spread. COVID-19 vaccine. So, how does the vaccine work? Vaccine contains spike-making instruction known as spike mRNA, which our cell will read in order to make spikes. These spikes on our healthy cells will help stimulate our immune system and prepare it for potential infection. mRNA cannot be injected directly, so it has to be repackaged into an oily bubble. So we can see the picture. First, we do injection in our deltoid muscle of the arm. Then, an oily bubble will fuse with our healthy cells and release spike-making instruction. Cell will read the instruction and build spike. Spike will migrate to cell surface and can be recognized by our immune system. This vaccine will make a person have a large army to fight against the coronavirus. So about the question, is the COVID-19 vaccine is safe? Absolutely yes. Why? Because first, COVID-19 vaccine is inactivated virus vaccine. It means vaccine containing deadly viruses. Second, virus-like particle vaccine. It means vaccine that we use virus-like particles. Third, protein subunit vaccine. It means vaccines that contain only a portion of the component of the virus, which are expected to stimulate an immune response formation. Fourth, DNA and mRNA vaccine. It means vaccine that we use can utilize the viral genetic material. And the last, COVID-19 vaccine is live attenuated virus vaccine. It means vaccine come from live viruses that have been attenuated so that they cannot infect or reproduce. So we can conclude that this vaccine is guaranteed safe and has positive impact and will help stimulate our immune system and prepare for a potential infection. Many people do not understand about the validity of news. Many of them also spread hoax easily. Someone said the COVID-19 vaccine has a chip for tracking people. Only adults are at risk of being infected with COVID-19. Sunbathing can heal COVID-19. So what can we do if we hear that hoax? First, we can check valid source of information about COVID-19. Second, we can think critically and clearly. Third, ensure the credibility of the site of being read. And the last but not least, don't spread the fake news. Now we go to axiology perspective of philosophy of science. Axiology is the science that focuses on the issue of the value and usefulness of science. Axiology also asks to question our value, our priorities, and what matters the most. It's really important to think in philosophical axiology point of view during the COVID-19 pandemic. Yes, of course, it is important because philosophical axiology point of view is expected to develop science along with their moral value of human life. And also, values and benefits inherent in science should be able to form the basis for developing solutions to the pandemic COVID-19, such as the development of vaccine COVID-19. Of course, this requires the intervention of many parties, such as health workers, public, and the stakeholders. With this philosophical of thinking, we can use science to fulfill our daily life. We can also implement it in the COVID-19 pandemic event. With this philosophical of thinking, we can use science to fulfill our daily life. We can also implement it in the COVID-19 pandemic. With this mindset, we can determine the truth and credibility of COVID-19 so that it can play a role in reducing the increase in COVID-19 cases. The last, we discuss about the role of stakeholder. Our President, Mr. Jokowi, has instructed state officials about the COVID-19 vaccination program. There are, first, COVID-19 vaccine is given free of charge to all society. Second, state officials are prioritizing the COVID-19 vaccination program start 2021. Then, society also asked to do 3M, which are memakai masker, menjaga jarak, dan mencuci tangan. The government also has a strategy to implement 3T, which are test, trace, and treat. And this also assisted by the vaccination program, so it can support preventive action for the spread of the COVID-19. The public is also encouraged to do always 3M, memakai masker, menjaga jarak, dan mencuci tangan. So, we can conclude, in optimizing the COVID-19 vaccination program, synergy is needed between stakeholder and the community. The application of philosophical concept will benefit stakeholders and society in understanding the importance of vaccine and their effectiveness. So that's all about my discussion. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.